Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Nikki Hopewell. She's a communication strategist, and she wrote the Kevin MD article, Healthcare Organizations, Clean Up Your House First, then you could tackle racism in patient care. Nikki, welcome to the show.
Thank you so much, Kevin. It's a pleasure to be here.
So we'll get into your article in a little bit, but first off, can you share your story and your journey to where you are today?
Sure, absolutely. So I'm a trained journalist. I have 2 degrees in journalism from Northwestern University's Medill School of Journalism. Go Cats. And I've parlayed that experience into marketing. I've been in this career for over 25 years. Started out in print journalism, and my mom became ill with uterine cancer, and I took an interest in healthcare content marketing and just sort of dove in from there. Since the start of my career, I've really always been interested in telling stories, but I always wanted to tell like honest stories about how people experience the world and what we can learn from those experiences. I've always been a believer that stories sort of really connect people and help us foster empathy, which quite honestly, we just need a little bit more of right now.
So you work for a major academic medical center in Chicago. So tell me some of the challenges that you face from a communication standpoint, especially during the pandemic.
Sure. So I am beholden to internal and external stakeholders. So some of the challenges are just getting that messaging out, especially to internal stakeholders about the pandemic, about how it's affecting our communities that we serve. It's interesting, our audience, they dive into our content from our internal newsletter. So that's a lot of times where we put our stories, and I want to do it in such a way that people can receive the information. If you lay it in plain facts, black and white, it's not terribly interesting, but it's compelling when you tell it through the lens of someone's personal story. So that's what I often try to do. And that also extends to the community. Anytime we're trying to communicate a mission, we're an anchor mission institution. We're focused on health equity. We're focused on eliminating and reducing that death gap, where from the West Loop to the Gold Coast area, all the way maybe like 5 to 7 stops on the L to the west, in the western part of Chicago, of the city, you'll find great disparities in health. So we're really working to tackle those. So it's really about communicating to the community. We are here to support you. We do this in a number of wonderful ways. So that's kind of the challenge that I'm faced with right now, especially during a pandemic, and getting the community the resources that they really need so that they can have overall health and well-being.
All right, so let's transition into the Kevin MD article that you wrote. Healthcare organizations, clean up your house first, then you could tackle racism in patient care. Now, for those who haven't read that article, can you just walk my audience through it and maybe share the story of why you decided to write it?
Sure. So I'll start at the end first. So when the AMA came out with this statement about its new policy recognizing racism as a public health threat, I got really excited because I was like, okay, this huge medical association is finally acknowledging that they need to get some skin in the game, right, and really start working to make things better. And the policy identified, prescribed steps to combat racism, to help us get closer to that goal of health equity, where everyone gets what they need and pushes them toward overall health. But the closer I looked at this policy, I felt like all these steps were kind of outward facing, meaning they're largely focused on the treatment of patients and or community members, which is vitally important, right? It's key, don't get me wrong, but it didn't seem to put like a fine point on the fact that healthcare institutions can't possibly make any real headway until they start to address how their own organizations are dealing with anti-Black racism within its walls, among its peers, from managers to direct reports. And so if you can't examine the aspect of racism within your own organization and how it affects your providers, you can't possibly be prepared to support this effort and how it affects, the patients and your community members that you're trying to care for. Your efforts are just going to full on fall flat if organizations aren't turning the lens on themselves. So after the murder of George Floyd, I had so many Black colleagues coming to me who are providers, sharing stories of how they walked into work, Kevin, the next day, and it wasn't even a topic of conversation. And they were having to push through like incredible pain. And that's just not okay. So when this policy came out, I really wanted to put healthcare organizations on notice and say, look, if you're really committed to being anti-racist toward Black people, you can't skip over the part where, you look closely at what your organization needs to do to be better. It's really uncomfortable, but it's so necessary if you want to make progress and truly advance health equity. So this article sort of dives into, listen, it's really time to look inward and make that change, because from there, only then can you start to make changes with your community and your patient care.
So I wanted to follow up on that story about George Floyd. So I guess my question is, what should health organizations do in a situation like that?
So I think transparency is critical. You can't tiptoe around this. It's just unavoidable. Having these uncomfortable conversations are necessary. And I think organizations really need to sit down and form some sort of task force or committee that's dedicated to taking a pulse check of the internal organization. How are people feeling within, which is what Rush did. They formed the Racial Justice Action Committee, which I talk about in the article, and it's dedicated to figuring out like how we can better navigate this path. There's health equity outside of an organization, but in terms of health equity within the organization, that matters too. So it's a matter of starting having conversations all across the organization, making sure that peers are sort of checking in with other peers and recognizing our own internal biases, right? We all have unconscious bias, things that we bring to the table that we don't even realize. So we kind of need to check in on that and figure out what they are, because if you can't identify them, you're not going to acknowledge them. So it's really about taking a pulse of the organization and checking in with everyone and saying, where are we at and what can we do better? What types of things can we put in place, like committees, like task force, like checks and balances, like governance, all those things that really help the organization get health equity internally.
So you mentioned a task force that Rush University created. What were some of the discussions within that task force, and what were some of the actionable suggestions and steps that came out from their actions?
So the Racial Justice Action Committee was formed with members from all across the institution. So different levels of hierarchy, different areas across the institution. And so they came together and said, first, we need to figure out what's really going on. So they did a survey that they launched across the organization. Everyone was invited to participate. I think we had like 3/4 of the organization sort of weigh in. And Kevin, they were honest. They were asked, what things do you think need to change? Where could we be better? And honestly, people said, listen, I have trouble with my managers. They don't feel like, I don't feel like a valued part of the organization. I get passed up for promotions. No one seems to care about my concerns. If I do raise concerns, then there's going to be penalties and it's going to be punitive. So I don't feel like I even have recourse. So all those things were addressed. And finally, we brought in a consultancy to help us navigate through all these responses and figure out, okay, what kind of recommendations can we offer up? So there were recommendations for how to improve communications, how to improve hiring, how to improve dialogue between peers, how to check in terms of mental health, how to help move us forward, what ways can we be better as an organization? So, we ended up creating a very transparent set of recommendations. We shared it out with the organization overall. We had a town hall meeting. People were, I think, encouraged, but now is really when the implementation has to begin. We can't just sort of say, okay, we've collected all of your information and we're just going to sit on it. Now we have to really start acting. So we've put together some additional town halls that address concerns over, for example, what happens when I file a complaint, when I feel like someone's, made some sort of racist situation has occurred in my area, like what kind of recourse do I have? So we've set up things so people understand how the process works, that there is a process in place. We're encouraging people to have conversations within their departments, and people are like, I'm not a facilitator, I don't know how to do this. So we're giving them resources to help them facilitate these discussions and help them navigate them. We've had discussions with our community members and asking what they need from us as an organization. So there's internal work, external work. It's really a comprehensive strategy, and I think it's going to prove to be very fruitful going forward.
Now, for organizations who want to look inward when it comes to the topic of racism, does this impetus need to come from the top down or grassroots from the bottom up? And if it does from the bottom up, what are some things that individual clinicians can do to get those conversations going?
It's a great question. I think yes to both, right? So I think the grassroots piece is important because that's sort of where the movement happens, and it gives people access and makes people feel like I don't have to be a senior leader to get some input in and to get some skin in the game and become a change agent. That's one of our the language that we sort of use. We want people to sort of take it upon themselves to step in and become change agency. So what does that look like? That is having those difficult conversations. We started a book club, and we're going to be reading Cast, right? So it's diving into unfamiliar territory and just saying, I didn't know that I had this implicit bias. Help me understand, help me grow. It's also about not putting the onus on our Black providers and clinicians, right, to explain everything, but maybe they can guide. And Google is a source, right? It's a great resource where people can sort of dive in and ask questions. And there's tons of anti-racist materials. We've provided some through our Racial Justice Action Committee so that people can kind of get educated on what some of the issues are, how to talk about them, how to manage them. And from a leadership perspective, it's about really being open as a leadership team to say, you know what, I admit we have faults, we need to change, and then bringing those two things together, right? That grassroots initiative has to come into play, and the senior leadership has to laud it, has to celebrate it, has to encourage it, has to be a part of it. It can't just be, here, you go off and do the work, but we support you. It's them getting skin in the game too. We've had many leaders share interesting stories of racism that they've experienced. We have a VP of government relations who's 6'3", huge Black man. He took off his suit because he wears a suit every day. And he literally decided to change uniforms and put on a food and nutrition uniform, walk through the halls. Kevin, no one acknowledged him. No one knew his name. No one greeted him. No one looked him in the eye. And so it's experiences like that that help us recognize, okay, we need to do better. And here are the trouble spots. And senior leaders, you need to dive into and admit that there are problems. And then those grassroots efforts will feel like, okay, we feel like we can do this. We're allowed to talk about this. We're allowed to have these conversations.
We're talking to Nikki Hopewell. She's a communication strategist, and she wrote the Kevin MD article, Healthcare Organizations, Clean Up Your House First, then you could tackle racism in patient care. Nikki, one of the things that you mentioned earlier was the power of storytelling to change minds. Now, can you tell me what the role of stories could be in terms of tackling racism within healthcare organizations?
So I think the challenge is always empathy, like I mentioned earlier. And I think what stories do is create empathy. If you can walk around in someone else's shoes and experience their lived experience from their perspective, which is not always easy to do, right? That is a game changer. If you can present one scenario to one person that allows them to step out of their particular perspective and into another's, and even if just for a moment they recognize the discomfort, then they can begin to say, okay, I don't get everything, I don't understand it fully, but I get that piece of it. And from there, you can start to begin to have a conversation and things can begin to change. If you can't get people to empathize, there's no connection point, and stories are all about connection. So it's really the role of storytelling and getting people to connect and understand we're all in this together. We have to find some common ground. What is it? It's empathy, finding that point of empathy.
And my final question, what's your take-home message that you want to leave with the Kevin MD audience?
It's really important to learn what allyship looks like and to begin doing the work. That means that you'll have to be open to learning and open to recognizing that you yourself have some biases, and that's okay, and you're not going to be perfect about it. And that's okay too, as long as you're willing to learn and be open. Check in on your Black colleagues. Make sure that they're doing okay, because this time is really difficult for them. Black people work twice as hard as their white counterparts to get 1/3 of the respect, right? So it's about really leaning in, recognizing that you don't know everything, but offering up some means of support. Hey, how are you doing today? What's really going on? And I know this can't be easy for you, but as best I can be, I'm here for you. And just get comfortable really with learning how to get uncomfortable and just moving forward from there. That's where change really can begin.
Nikki, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thanks for having me, Kevin. It's been a pleasure.